My name is Gina. I work for the Alport Syndrome Foundation. I am the executive director. Right now, we are the grant recipient of a Global Genes grant for our Ask the Experts program. And this program came about as a result of our family meetings. We have had family meetings for a couple of years now where we gather patients from a certain area and experts and allow the patients and experts to interact and for the families to be able to ask questions on various topics specific to Alport syndrome. We were saddened that we can only go to so many communities, and we knew that that information would be so valuable for patients around the country and really around the world, and wanted a way to be able to provide anyone who wanted that information with it. And so we developed the idea of our Ask the Experts program. We were fortunate enough to have the contacts through our medical advisory committee, and from the meetings that we held, we had the experts in place, we knew what we wanted to do, and we just needed the funding to help bring us to the finish line and make it a reality. And thanks to Global Genes, we were able to do that.
When we learned about the opportunity to design a 3D printed exoskeleton hand for our kids that would effectively help them open their hands and then allow them to do some simple bimanual tasks like riding a bike, holding a Coke can, holding their backpack so they can unzip it, and taking that process and taking it out of the traditional setting and essentially giving the parents the opportunity to measure their child's hand, measure their child's arm, download and print those 3D pieces in their own community, all for less than $50. That seemed really exciting to us and disruptive because it takes a process that we're all frustrated with and familiar with, and it puts the power in the hands of the parents to make a device for their kids that could allow them to have function that they previously did not have.
We see Global Genes as partners. I wouldn't call them grantors. There's definitely a different partnership feeling from them. They're checking in with us, they're asking great questions, they're wondering what else can be done. I don't feel pressure from them at all, like where are you with this frog arm and is this really going to happen with the money we gave you? We hope it does, but that's part of the process, right? Is this innovation may not happen in 1 year, and I don't at all feel organizationally that we're under any sort of pressure to get this done tomorrow. It's more of a
get it right.
Get it right, you're going in the right direction, and we're here to support you.
And I don't think we've had one conversation where it didn't end with a Global Genes staff person saying, what can we do to help you?
Right.
What do you need from us?
Right.
Which is tremendous.
Global Genes inspires us to innovate, and I think that's 100% necessary in the rare community. Without an organization behind you telling you, you know what, your idea is actually not that crazy, let's try it, then we can move forward with these ideas.
What we had proposed for the Rare Patient Impact Grant was a focus group for caregivers of children with Zellweger spectrum disorder. What the Rare Patient Impact Grant has done for us in this focus group project was give us just a very clear-cut way to bring this idea we had to fruition, and we're very grateful for that. But more importantly, I don't think either of us could have even fathomed the real impact that this has had on, our understanding of our families, our understanding of our community. We had no idea that we were going to get this much information, and we're kind of blown away by it. So what I would say to anybody that is considering applying for a grant or supporting this grant process, the impact that you can have in supporting this is just boundless, it's endless. Even if you go into it with a specific idea in mind, it could have so much more far-reaching impact than you could have ever imagined, and that's definitely what happened to us.